Anybody that may have seen any of the local news through Billings, there's a family that has this that got Extreme Home Makeover. They built them a house, and it's a mother and 3 daughters that also have this problem. What it is in the congenital form, the back of your skull is volumetrically too small. And it causes a crowding of the brain, and it causes the cerebellum to herniate downward. It's like corking a bottle. So your cerebellum literally gets stuffed down into your C-spine. And ergo from that, you can have 25 different problems, symptoms involved, anything from headaches, nausea, dizziness, floaters, hearing problems, neuropathy, disruptions with your stomach because the pressure that it can put on your brainstem can cause tachycardia. Katie had horrible tachycardia issues for about 1.5 years. We were hauling her into the emergency room probably twice a week because she would literally just drop to the floor, just black out, and she was gone. She's been stitched up, numerous times. To back up the train, in 2004, she was diagnosed. She'd been out in the Bay Area riding roller coasters. The G-force basically knocked it into high gear. She came home, and that's where our journey started. She had her first surgery in Billings. They removed about business-sized card of her skull, and that's called a decompression. And the idea from the local docs was to back the pressure off. Unfortunately, I didn't know anything at the time about this disease. The cerebellum was still stuffed down into the C-spine. And we went for about 1 year and 4 months after that, watching our daughter waste away and deteriorate. We also had a condition called Ehlers-Danlos syndrome. It's a connective tissue disorder. Our ligaments and tendons are too stretchy. So when they did the laminectomy, they had to work on that. It also kind of spreads out your tendons and ligaments and muscles. It caused cervical instability. And not long after that is when she started to black out. Her joints started to dislocate in her shoulders and her hips. Right now she's partially out in her shoulders in that region. Basically had no clue, kept going to the doctor, what's wrong, what do we do? Things just kept snowballing. We ended up literally out of state at the Chiari Institute in New York. She had her first revision surgery done out there in May 27th. They went in and opened that back up and cleaned all the scar tissue out that had built up, and basically did a duroplasty. They cut the lining over the brain open and went in and cauterized those tonsils and dealt with the obstruction. Because what had happened was she was developing a secondary thing called syringomyelia, which is a crippling disease because the spinal fluid could not travel from the brain down to the spine as it's intended. It's a cushion to your spinal cord. She went through that. It was a tough surgery. Took her home. 6 months later, boom, we're blacking out again. Couldn't figure out what's going on. She had cervical instability. Katie is literally rotted. She has titanium rods screwed into the back of her skull, hooked into C4. It failed 2 months after that because of the Ehlers-Danlos portion of it. So we were back out there 3 months later in July, and she had an anterior fusion from 4 to 6. So literally in January of last year, they found out, because this is it's fairly new medically, it's been around forever. They used to find it via autopsy. It was too late for people. But now, through the research, they found that most of us have tethered spinal cords. So they have to deal with that. So given all that she's had done, this kid is in a lot of pain. Even after all the surgeries, Chiari doesn't just disappear. It's a structural issue. They go in and they try to stabilize you so they can get things moving again and get you as stable as possible, and then you live with the results. It seems to be different for different patients. Katie still suffers from a lot of chronic headaches and migraines and the nausea. The nausea is just unbelievable. The kid will vomit for hours. What medical marijuana has done for Katie, from a mom's point of view and from being her caretaker, I'm not picking her up off the bathroom floor nearly as much. We were hitting the emergency rooms probably twice a week for IV drips of Zofran and Dilaudid. Katie right now actually wears fentanyl patches, and we're hoping that as we get rolling with this and kind of, get our feel for it and get moving, that we'll eventually be able to get her off of the narcotics because she's very, very young. Just as they've said, you take drugs, you can have a dozen or more side effects. Muscle relaxants that they've given her for the horrible muscle spasms basically made her sick and put her into a coma practically. Katie missed her freshman, sophomore, and junior years of high school. So right now, because of medical marijuana, she is able to go to school part-time, and she's working on an internet program between that and 2 of her senior classes, so it looks like we'll have some success this year. And that's basically, from a mother's point of view, I've always been pretty conservative as far as politics go. I've been Republican, and I voted for Initiative 148, not realizing that my daughter would need to access this program. And it has literally saved her. And on a day-to-day basis, she's able to function better.
In my story, last year I've had a life. I can wake up in the morning and go to school. I don't know, it's like a miracle drug. I've tried everything. I've done everything the doctors. I'm sorry. It doesn't give me side effects. I don't eat, so when I smoke, I can eat. I go for days without eating, and it's the only thing that helps me. And I don't feel high when I smoke. Usually most people can't tell I'm high because it brings my pain level down so much that I function like a normal kid. I'm so nervous, I don't really know what to say. It's a miracle drug. I can't really tell you. It works different for everybody. It's like a...
Made a huge difference in
all the joking aside, the Cheech and Chong stuff, and because it is kind of, there's a light side to this too. We have to keep it light. And the serious side of it, like I said, I'm 40 years old. I'd never smoked weed. It's not that I hadn't been around it. I grew up in a little cow town, eastern Montana. As a parent, watching my child, who was an honor student, an accelerated athlete, literally, her life just kind of, being slowly cut down, literally week by week. I am a conservative person, I must say. This stuff works. So any religious beliefs, that you may have been raised with, or any moral beliefs that may have been instilled in you, if this is used properly and this is done not for recreational or illegally, but just for the sake of medicinal marijuana, and I'm telling you, it's literally saved my daughter's life. She couldn't eat, like she said. The pain level was so bad that she was bedridden on the couch. This works. And I just want to challenge you and ask you all to please, regardless of what your belief system is, maybe some of you smoke weed to unwind it. I mean, people do use it. I mean, that would be a form of medicinal, even though you're not a registered patient. We live in a very stressful world. But if you're not one of those people that's ever meddled with pot or smoked, recreationally, please, take this to heart and really look at this on behalf of Kate, because I think you're going to see a lot more Carrie patients come on board in the future because of so many of the issues that we face with it, and it's partisan-law. I have a lot of health issues. I'm looking at becoming registered myself, not to have to use daily like her, but as needed. But it is a medical drug.
Chiari is so much neurological, everything too. All they really offer you is pain meds. I'm maxed out on pain meds. Every time my tolerance gets higher and higher. My teeth are cracking. If it's doing that to my teeth, I don't want on it. Why should I have to be forced to take painkillers when I have something? Yeah, and it works.